Good afternoon, everyone. Welcome to the HILT Lunch and Learn. We have the King Workforce and Crisis Care Investments overview, and we are very excited for this presentation. I want to definitely welcome everyone here, and we're going to start out with our HILT captain, Dr. Ali Thomas, and I will give it over to Dr. Ali.
Thank you so much, everybody. This is really exciting and really important. I'm so happy that we're talking about mental health in the community. I just have been in my, I don't know, 22 years as a doctor, so baffled by the disjointed mental health system. I think back to how we created community health system, community health um, systems back in, I think it was the 70s or 80s, and then killed all our community mental health. And it's just like we never learned our lesson since then. So I'm so happy that King County um, has begun to do something different. So welcome. This is going to be a great day. Let me just lead off with our just a reminder of our purpose. We are a network of diverse, this is the next slide, small and large healthcare providers in Seattle, Kings, Snohomish, and Pierce counties who come together to share and take action on improving access to a skilled healthcare workforce. And we are a we. So I'm going to say if anyone is not too camera shy and doesn't mind turning on their cameras, I know we don't always feel like we can, but would love to see faces if possible. I always love to see the faces of the people I'm talking to. And I know you do too. Um, Remember, since its launch in May 2018, we've HILT has made improving equity and diversity in the region and our workforce a set of guiding principles. And especially, we like to see diversity of faces, diversities of backgrounds, diversity of this is another hint to turn on your camera, diversity of preparedness, earphones, all of those things. I see the cameras coming on. This is wonderful. Yeah, thank you so much. So our agenda today, what we're going to do is we're going to review King County centers and residential investments, examine those crisis care centers and where they are and sort of the continuum of care, and then share about the crisis care levy workforce investments. And we are so fortunate to have with us Rachel Drian. I'm going to jump into her bio because Rachel is going to be our first speaker. She serves as the Behavioral Health Workforce Investments Manager for King County Department of Community and Health Human Services and leads strategic initiatives aimed at strengthening the workforce. She's got a decade of leadership experience in public service here in Washington State, in DSHS, HCA, and transforming the Medicaid system to meet the needs of our most vulnerable populations. Plus, she's a proud mother of three, loves to travel, and she somehow still believes in the Mariners. Don't know how. Okay, thank you, Rachel.
All right. So, hey, everybody. Absolutely. Go Mariners. Nice to meet all of you. I was just taking a look at who's all here, and I think there are definitely a few people that I have not met along the way. And so, nice to meet you all. I'm going to kind of start us off, and just to kind of take you through this overall discussion around kind of workforce and crisis care investments. And then I have some partners on here who we're all working together. And so I'll have them jump on and take their slides, and we'll go from there. So, the behavioral health workforce in King County is obviously facing severe shortages. It is a major thing. The crisis is really intensified with a mix of things like inadequate wages, escalating living costs, substantial student debt, and which is contributing to high turnover rates and lots of vacancies. The shortage of qualified professionals is significant among master's level mental health clinicians and SUD or as substance use disorder trainees and practitioners. And so, and then the other real thing that is a major concern for our overall workforce is that the current workforce composition doesn't really adequately mirror the diversity of our community. So this is impacting the effectiveness of the trust in our healthcare interactions. Let's see, workforce overview. Yeah, so to tackle the pressing workforce challenges in 2022, The Department of Community and Human Services at King County has a division called the Behavioral Health and Recovery Division. I'm sure many of you are familiar with it, but I do know there are a few people on the call that I thought I would take a minute to just, call out who we are. And this Behavioral Health and Recovery Division is works to kind of bring a whole network of all the behavioral health providers in the community, especially Medicaid providers, and to actually fund and to sustain and stabilize the behavioral health providers across our county. So back in 2022, they added a new position with some ARPA funding. It started out that way, where we had some COVID, or what they call COVID funding, or Clifford funding, or ARPA funding. But they said, hey, we've got a little bit of money. We need to bring on some staff to talk about how to get that money out into our provider network, and to start thinking about workforce capacity. And so I jumped over from Department of Social and Health Services, where I was leading some of these residential treatment facility work, and came over to start out talking about what do we need to do for workforce and behavioral health. So we can jump to the next slide. Oh yeah, so the primary goal that we set out to do with that original $5 million was to stabilize the workforce within the community behavioral health organizations who are Medicaid funded, and to stabilize what we call the King County Integrated Care Network. And I'll, if you want to skip to the next slide, I'll just, if for those who are not familiar, click again. Next slide. Hey, I forgot I put these little people in there. This was something new I've never done. So there we go. So we've got these little people saying, ta-da, these are our workforce people that I added to the slide deck. But the King County, for those who are not aware of what this is, the King County Integrated Care Network is a dynamic public and private partnership that really streamlines all of the administrative processes. And we have a 50-50 partnership model between King County and the healthcare providers. And it facilitates the blending of Medicaid funding with local and state funding to enhance care coordination and service delivery. And then we can jump to the next slide. And so to support the needs of stabilizing this network, we are actively working hard to support the current behavioral health workforce, along with adding this next thing on, which is the crisis care center. So we're tackling financial barriers with assistance for licensing and professional fees. We're boosting skills through targeted training, and we're ensuring a stable supply of qualified professionals with pipeline initiatives, including the one you're going to hear about later today in the apprenticeships. And plus, we are absolutely all about supporting the well-being of our workers, making sure that they're well-equipped to provide the best care as possible. So all of these things are crucial for maintaining quality healthcare in our community. And then the next one. Yeah, and so here's what my team, and so I started out as a team of one. We grew in shortly after I came on board and started to work on the $5 million kind of investments. The crisis care levy passed, and so then it became a team of one workforce to actually a team of 3 workforce staff at Be Heard, and a much bigger and broader definition of what we were going to do over King County. And so so now we have lots of kind of a much bigger bucket of money, and quite a few goals and things to work on. So we're focused on enhancing partnerships and funding to support a sustainable workforce development, and increase training and ensure that the workforce actually is starting to reflect the community's diversity. So our approach really is going to be adapting to feedback. So we're really partnering. Like, the main thing for this whole thing is that we are working to bring everyone to the table to talk about who is already working on projects that affect the King County system in behavioral health. And so that we're not duplicating efforts. And, we are prioritizing retention through continuous improvement projects. And ultimately with that, I will say, are there any are we going to hold questions to the end, or do them after each presenter? I don't know if James or someone. I'm not sure.
Yeah, we can include them. Oh, go ahead, Dr. Ellie.
Yeah, I think we have a few minutes for some quick questions. People can just
Yeah, any questions at all on just kind of what I went over before I pass it on to my amazing partner, Ida Bell, who's going to give you the lowdown on the crisis care levy?
Quick question.
Yeah.
This is Monica from ICHS. I see that you have increased representativeness, promoting diversity and representation, and I'm just curious how you put that front and center to really invest and drive towards that, as opposed to a nice to have, especially since this is all um, really impactful in terms of creating, you know, providers who represent their communities that they're serving. Do you have specific strategies that you can talk about?
Sure. Yeah, and I'll tell you the strategy. I mean, I think that this was a big part of the discussion as we were moving along of like how are we going to actually implement and do this. And so we've had, you know, with having this network of providers, we have the opportunity to collaborate all of the time. You know, and so we have this we have a couple different things that we call learning collaboratives. And those are opportunities for all of the providers to come together and to really give us feedback on what's working well, what's not working, and what ideas they might have for things. We also have a workforce development partner learning collaborative where the whole everybody we could think of, and we would love to invite you to, that is interested in workforce comes together and talks about strategies that they're using in that larger federal, local, state, and evidence-based practices and things that are happening. You know, how do we bring that discussion in? So we're having a lot of discussions. That's one strategy. The second strategy is that after listening to our own providers, because the step one of our job has been to stabilize the current workforce, right? So we're working to stabilize what we have out there right now. And so we are putting funding out and we're in the middle of this process right now. What we heard from each provider is everyone had a different need. So what we have decided to do is for each provider to decide their own, and you know, with us after we started talking about and presenting ideas, each provider was given an opportunity to request funding that was specific to their agency and to show us how that money will actually work towards that goal. So that's what we're doing right now. I mean, we also have a little bit of money going out for a specific targeted increasing diversity in the youth world. And so we've got we're asking people to actually give us their strategies, and then we'll decide which one is going to be the best. So a couple different ways that we're going about this. But one of the things we really notice is each individual provider really needs to be supported where they're at. And some of those efforts are already going for them. And so we really wanted to fund projects individually. And so that's how we're going about it.
Okay, thanks.
Mm-hmm. Anyone else? All right, Ida Bell, you're on deck.
Good afternoon, everyone. My name is Ida Belfast. I am the community liaison working on the Crisis Care Center initiative, and I'm excited to be here and tell you about it today. I am going to try and see if I can get the slides to move. There you go. Okay, so our Crisis Care initiative, last year in April 2023, the ballot initiative came to King County voters, and it was passed unanimously by the citizens of King County. And instantly, the county created a team to come together to write what was called an implementation plan. And the implementation plan is basically the blueprint for how the crisis care centers are going to work. And so what it addresses is what is missing from the crisis continuum. In our crisis continuum, we currently have someone to contact, and we have someone to respond, and someone to follow up. But there was no place safe for people who were having a mental health crisis or a substance use crisis to go. Typically, those folks would end up either in the emergency room or in jail or in other situations that we would rather not discuss. So the crisis care centers are going to fill that spot of someplace safe to go. The crisis care center levy, the way it was written, has three paramount purposes. The first purpose is to establish and operate 5 crisis care centers in King County. So the way that will work is that the county is broken up into 4 crisis response zones, and there will be a crisis care center in each of those zones. And then there will be another crisis care center that is specific to youth, and that can be in any of the crisis care zones. The supporting purposes of the levy are around residential treatment and the restoration of the number of mental health residential beds to what they used to be, and making sure that we have sustainability for those for residential treatment. The other purpose is around the community behavioral health workforce. So again, as Rachel was just discussing, it is around the sustainability and representativeness of the workforce in King County. The way this levy works is that it is a property tax that people pay into, and because it passed in April of last year, we began collecting money in January for that tax. It is a 9-year levy, and so we will be collecting money that will be paying for these services in this way. The way it has been written out is that there's about $626 million that's going to go specifically toward operating the 5 crisis care centers. There's 173 million for residential, 163 million for community health, behavioral health workforce, 67 million that's going to our early crisis response, and then 111 million that is going for capacity building and technical assistance for people who are involved in the work. The early investments that I was talking about, because we started collecting money in January, we wanted to make sure that folks understood that even though our crisis care centers are going to take some time to get up and running, that we were putting money into the system as it is now to help shore up our response. So we took the money that started coming in January, and we have been putting it into these services. So we are expanding mobile crisis services for both youth and adults, and we are helping embed behavioral health counselors into 911 call centers. We are looking at reducing fatal opioid overdoses. So we have expanded access to opioid reversal medication and putting in some capital facility funding for substance use services. The expansion of that includes some great vending machines where people can get naloxone if they need it, and it's at no cost to them. So those have been being put around the county, and they're already getting some great response. We also put some money into residential treatment to preserve the existing capacity and build new capacity. And then we also are working on the behavioral health workforce investments, as Rachel is talking about. So here is a list of the money that is being spent and how. The early investments are listed on this first slide, and it goes through some of the specifics of time and amounts. I won't go into all of those details because it's a lot of numbers. And then the mobile expansion information and the behavioral health counselors, all of that is in this slide. So as you can see, we are putting money into, for example, with mobile expansion, looking to have folks available through DESC, and CORS for the mobile crisis response for both adults and youth. I'll give you a second to look at all of those numbers as well. And basically, the way things are going to work are that we have our timeline for the crisis care centers opening. And the first one is expected to be open by 2026. And then all 5 will be up and running by 2030. And the reason that that takes so long for that to happen is because of the process that is in place for how you open a crisis care center. So for that specific process, we're looking at putting out a request for proposals that will come out probably next week or the week after. And it is going to be a competitive procurement process where we will be looking at applications from behavioral health agencies, and they will have to tell us what it is that they plan to provide as far as not only services, but as well as what the physical location will look like. So part of why it's going to take such a long period of time is because when you build, if they have to build a new facility, the permitting and the actual building of the space takes a really, really long period of time. So when we put out the RFP next week, the behavioral health agencies will tell us whether or not they have a space already available or if they need to build one. And then we will be going from that point. The way it's going to work is that in the RFP, in the first cycle, there will be 3 probably CCCs that will be chosen to be awarded the grants. And then next year, we will do another RFP process for the next 2 CCCs to be chosen. And then if we need to, there will be another RFP if there are still some sites that have not been designated. In the RFP, the Behavioral Health Agency not only has to tell us what the site is going to look like and where it's going to be, but they also need to tell us about how they're going to run the crisis care center and how they have been working with the communities and the jurisdictions to make sure that they are prepared to have the crisis care centers in their communities. So they need to show us that they have local jurisdictional support as well as community support. And then they will be able to open the crisis care centers. So each crisis care center will be run specifically by the behavioral health agency, not the county. And a behavioral health agency could feasibly run up to 3 of them, but no more than that. And so we will have 5 crisis care centers, as I said, one in the north, one in the south, one on the east side, and one in the central area. And then the youth site, which could be in any of those. I know that's a lot of words and a lot of information that I just ran through in 3 seconds. But does anyone have any questions about that? Okay, then I'm going to hand it on back to Rachel. Thank you all.
All right. Boy, I thought there'd be all kinds of questions.
So did I.
Yeah. I'm like, wow, well, you did such a good job. All right. Well, back to me. So I'll talk just a little bit about specifically, what our workforce team is now doing to kind of to get things going. One thing I want to stop and say is that, now that I've talked about stabilizing our case, our King County Integrated Care Network, and then essentially figuring out how we're going to have enough staff to to build a pipeline and increase our staff by 5 full new facilities. And knowing that that's what our job is going, that's a lift, right? I can tell you that I did a survey last November to our current agencies asking about vacancies, and we were able to identify at the current moment there was about 800 vacancies across our continuum. And this is, and a pretty high burnout rate and retention rate. And so, most of the work that my staff is really trying to do is to look at how do we, oh, no voice. Okay. And, how do we really look at how do we put things in place to start working on building that pipeline and really start targeting our bigger community around what is behavioral health workforce and why would you want to work in it? And so what I know is that we did what I can tell you is that we asked a series of questions to a bunch of high schoolers about what is behavioral health, and about 100 of them didn't even know what behavioral health is. I mean, I know behavioral health is not, it's like we're moving towards that. So you could say, drug treatment or mental health, but the fact that my own children, I've been working in the system for 13 years and they're all adults now, couldn't tell you what behavioral health means is enough for me to indicate that we have to think about lots of different impact or engagement strategies along the way for people to, come later in life, early in life, right? All of these different things. And so strategy 3 is really about bolstering the community behavioral health workforce through targeted initiatives, right? We are working on providing, and I mentioned this already, training and licensing, fostering labor management workforce development partnerships, and that's a lot to talk about. And but I'm going and Melody is actually here from our partner that we're working with, who will be going over that portion of things and the apprenticeship program that we're working on. So we know that we have to focus in specifically on some specific clinicians. And so we're working with the healthcare training fund, and they will be doing that. So we also know that we need to work on doing, continuous training and offering specialized training for crisis response roles. And so we will be putting out an RFP later this fall around, getting someone in to look specifically at how do we build a crisis training academy that will really focus on, King County specifically, and to bolster kind of this new way that we need to think about how we approach behavioral health. And so we'll be doing that as well. And then if we talk about timelines, go to the next slide. I just figured out that I can move these slides myself. Sorry. But the next slide really is just that timeline that Idabel already talked about. The first few years my team is working to actually stabilize, and build, and we'll come back in a couple years and present to the council on what we're seeing and what we're finding and what we're doing, and maybe reconsider what else we might need, or and so we have the opportunity to really to pilot some things and to look at different evidence-based practices that are happening. Behavioral workforce is becoming this, I'll say that being someone that's worked in the system for a long time, I was the budget chief for the Medicaid budget chief for Healthcare Authority, and then for DSHS across the Western state, Eastern state. And so I've been here doing this work for a very long time. And nationally, the conversation is really just now starting to focus in on how do we not just talk about health workforce, but we call out behavioral health workforce as this other thing of this, this other piece of health that we have to seriously target. And so we're working, we've been working closely to bring those voices in and to partner with all of the other states and all of the other local jurisdictions to look at what they're doing. But everyone is, trying to figure out how this approach, what we can do to actually retain and to build our workforce across the whole nation. So this is what we're, let's see, the next one is, oh yeah, so here's what we're doing. And so this is kind of what we set out to do in the next, year and a half to the end of 2025. Specifically, we have a strategy of it's like almost about $24 million-ish that's going to go out to stabilize and build and fund all of these different ideas and targeted investments. We are investing about $6.5 million in providing our provider network with internship funding to actually have stipends for internships, so people who are doing internships actually get paid. We are bolstering up any of the agencies we can with clinical supervision. We know that you can't add internships. We need to add the ability and the availability of internships across all of those different credentials and the professions, and that the agencies often don't have enough clinical supervision they can't even get people into the clinical supervision field, so we knew that we have to focus in on that. We're also providing training specifically to help people get to a clinical supervisor role. And then we're also providing some funding for well-being initiatives. So, how do we look at burnout? How do we approach, giving people an extra day off, or thinking about how we really work within our workforce to give them the things that they need to feel supported. And so we're doing that. We have about 4 million, or let's see, about 3.5 million happening just around training. I mean, we identified right off the bat that this was one of the main things that the providers came back and said is a priority. We are working on, specific train the trainer and long sustainable overhaul comprehensive training for dialectical behavioral therapy and cognitive behavioral therapy for psychosis across the network. We have added the option of Relias. So Relias is a LMS, or learning management system, that is one of the learning management systems across the nation that actually focuses in on behavioral health, has more of a behavioral health lens in it. And so we expanded our contract and have made that available to all providers in the network, so they have free access to an LMS. And then we also developed out some recommended trainings for people to help build, these, and I don't say green, that the new workforce, people who are just now kind of coming up and just got maybe they have an SUDP license, and they now are going to become a clinical supervisor, but they don't have any management or leadership training. So how do we make sure that those folks that are moving up the pipeline actually get those trainings and have the ability to build their skills around supervision and leadership. And so we focused in on that. The last couple things in here, we are going to, I talked about the RFP for a crisis training academy. And then we are allocating that about 5.5 million to enhance apprenticeships in behavioral health and including curriculum enhancements to support mental health providers. And so we are working with the Healthcare Training Fund and others to get that done. And then the next thing is we're directing $5 million towards professional development, tuition reimbursement, conference fees, complete reimbursement for everyone's clinical licenses. And we offered this out, and we're doing that in partnership with, again, the Healthcare Training Fund. And we essentially will allow, it'll be something that will help with retention and also building people, the staff you currently have, like growing our own, right? And so we also are putting out this RFP for youth, centering diverse youth healers, and to talk about, encouraging innovative solutions to retain diverse youth mental health providers and to talk about what that's going to look like in the future for our youth. And then we expanded our workforce team. And so that's what we're doing to bolster the overall thing. So the last thing I'll say here is around workforce team partnerships. We are working hard. We want to grow these out. This is actually a current list of all the providers that have started attending what we are calling the Workforce Development Partnership Partner Learning Collaborative. And if this is something that you are interested in just listening to, it's once a month, 2 hours on a Friday. And we come together and we do breakout groups and we talk about topics, and what those learning collaboratives are about are really essentially there to for the partnerships, like for the people. So we bring we ask people who are in the collaborative to actually do promising practice presentations, so something that's working well for them, and they present that to the rest of everyone, and then we talk about it in small groups. And so it has been really beneficial already, and we invite you all to be a part of that group. And so we'll put that in, hopefully, actually, Karen on my team, could you put the registration for that in the chat? That would be amazing. And with that, I'm going to pass it on, I think. Oh, look, I made little people that pop up. And the next one is, oops, too far. I am going to invite the Healthcare Apprenticeship Consortium, which is what I keep calling the Healthcare Training Fund, which is Melody. And I'm going to invite her up to talk about this partnership that we are creating with them and what that will do and what they're intending to kind of help with across the continuum.
So just so you know, there are a couple of questions in the chat for you.
Okay,
Maybe you can respond now or in the chat or
I'll
at the end.
respond. Oh, sure. I'll respond. Hold on. Are there
A couple of
plans?
questions, including my own, about the upfront costs of going through an educational pathway, whether
Oh,
it's
sure.
scholarships or tuition or rent. But a major barrier for getting students in is because they just can't afford to get through. How is this addressing those very fundamental needs?
Sure. So I'm going to start. I'm just going to quickly start at the top of these questions. And the name of the LMS is Relias, and I just put that in there. And are there plans to provide wraparound?
That one.
Supports for pre-apprenticeship? Yep, college students. Yes. So tuition isn't the barrier. It's rent. I know. I have 2 kids in college. Gotcha. Absolutely. So that is actually, when I said that we're putting the money out to each individual provider, that is actually, there's a couple of providers who are actually going to offer that, as like a housing stipend, and there are different ways. And but we have lots of different approaches to this at the moment. Some are going to be doing tuition reimbursement, some are going to be offered vouchers going, like, so they, like, some people can't even, of course, like I was a single mother, like I did not have the funding up front to live and go to college full time. And so, those are all things we're talking about in many ways. And each provider, in each agency across the network is kind of giving us their own individual approach to that. And so, because we're talking about how to build the pipeline, and then Melody will talk a little bit more about what they're offering for pre-apprenticeships and things like that. And then, okay, so when my agencies see the dollars, okay, they're going to see the dollars. They're going to see them by the end of December. So money's coming out, and they'll have money for both to help them backfill 2024 plus money to help them start 2025. And then we'll be reconsidering things for 2026. And then considering financial barriers to advanced mental health training, tuition reimbursement still doesn't help students who have funding to get through college and into graduate school. Why aren't scholarships made? Okay, so the other piece that I did not mention is that my staff is working very closely to do what we targeted technical assistance. We have identified as many scholarships as possible, to all of the different pathways, and we provide that out to our providers on a regular basis. We have an actual bulletin going out every 2 weeks that says, here's another way to get, reimbursement through the national programs. Here's the new college pathways. We're working closely with the Washington Technical Board and also, with DOH to actually partner around the scholarships that are happening. And then there's a Balmer Scholarship that we're doing. And the last thing I want to mention here is that we are actually, we have the YMCA is doing a pilot program where they have the staff from within the agencies have an opportunity to go from a bachelor's to a master's level. They're providing full free master's level education for 30 students. And that's a targeted diversity. We have at least half that are, specifically for BIPOC and LGBT and different things. So we're doing that. And then, Balmer Scholarship. How is workforce development relating to with the work of that group? So that's what we're doing. When we talk about why are we bringing a partnership, we're bringing everyone to the table once a month to talk about, tell us what you're doing that I can direct to the KCICN, so that we can just make this massive list of all of the different things happening. Balmer Scholarship, federal programs, state programs, local programs, healthcare authority programs, Department of Health programs. Bring all those resources to one space that everyone in King County who's providing services can access. So that's what my team is doing. And with that, I'm going to pass it over to Melody. And Melody, I'd say, since I cut into your time, just take it the rest of the time. Go for it.
Hi, sorry if you saw me waving maniacally. It's because I'm in a room where the light switches off after so long, and I was trying to get it to recognize I'm still here. Anyway, thanks everybody. My name's Melody McKee. I'm with the SEIU 1199 Northwest Multi-Employer Training Fund, very long name. I do want to just give a quick shout out to my colleagues that are on the call today. Many of them that are joining us could be doing the same presentation. We have Lee Christopherson, who's our Director of Strategic Partnerships, Mary Jo Manawis, who is our Project Manager, Sinitra Pickens, who is our Director of Strategy for Allied Health, Mary Grace Anthony, who is our Director of Marketing and Outreach, and Amy Bartow, one of our outreach folks. So anyway, we have a full team of people here today. So I'm going to go over this as quickly as possible, and then just please know that you can reach out to anyone on our team with follow-up questions since we're running super short on time. I'm going to focus today on our 3 behavioral health apprenticeship pathways. The Training Fund sponsors what's known as the Healthcare Apprenticeship Consortium, which is a statewide multi-occupation Washington State registered apprenticeship. It's super important to acknowledge that you might hear the term apprenticeship across different industries and across different types of programs, but a registered apprenticeship is unique in that it follows the structure and guidelines of labor and industries and all of the rules that come with it. Our particular pathways offer are highly structured, earn while you learn pathways that bring folks into the workforce under an actual job with the employer where they're getting paid to learn their trade. The division of the apprenticeship program is really into two components, what we call related supplemental instruction that we have connected to college credit, and then the on-the-job training portion. Apprenticeships in general, even though behavioral health apprenticeships are newer, we're a couple years into the practical application of this project, but they're a newer concept in the behavioral health world. And even though they're new here in this type of industry, they have a very long history of showing benefits, including the long-term savings from higher retention rates, increased employee loyalty, equity, diversity, and inclusion, and increasing the diversity of the workforce. Also, just the retention, not only of the apprentice workers, but the people who are mentoring them. There's a lot of retention data around that as well. Apprentice, the program structure I already mentioned is split into two things: related supplemental instruction and on-the-job training. And the primary thing about these pathways is that you would see that the balance of the on-the-job training and the related supplemental instruction is different than our traditional pathway of that college in-classroom instruction being a more heavy focus in the beginning and then getting a job later after you've gotten that education. This combines the two and makes it more equitable access opportunities for folks who can't afford, for whatever reason, to go to school, say at night and work during the day. It combines both of those things into the training pathway. We have three registered behavioral health apprenticeship pathways. We have behavioral health technician, peer counselor, and substance use disorder professional. And the first two I mentioned are one-year programs, and the substance use disorder professional is a two-year program. I will say, for those of you that are familiar with SUDP or SUDPT, it's important to note that this mirrors all of the licensing requirements that our state already has in statute. So all the competencies that are needed to be acquired in order for a person to become a licensed SUDP are present in our pathway. They're either delivered via on-the-job training or delivered via classroom instruction. And our apprentices take the same national exam to become a licensed SUDP in our state. This is a basic timeline. If you're an employer out there listening and you have an interest in helping to build your workforce through this innovative practice, this is a timeline of how we would get from here to there. But again, we're running super short on time, so I'm not going to spend time there, but we can follow up with questions. This is just a sample schedule for one of our pathways. So this is for the SUDP pathway, and it just identifies where the different courses are outlined and what a typical schedule would look like for a person. And you can follow up with anybody on this slide with further questions. I'm sorry that was super fast, but just wanted to be respectful of everyone's time.
Mel, there's a question in the chat that I think is a good question to answer from Christy.
Yeah, okay, that's a great question. Thank you. Our apprentices, so how it works is that we basically pair a person in the community looking for a job with the employer, or the employer might already have viable candidates. Sometimes it's a candidate who actually works on your staff in another role but wants to move into a licensed role like SUDP. And so the apprenticeship starts with a job. So it's not that someone goes through the training program and then is connected to an employer. It's a partnership where the employer hires for that role that they were already looking for. They're already looking to fill this role, and we either work with candidates they have developed themselves, or we connect them with other organizations who might know of folks that are seeking employment. I hope that makes sense. Anything to add from any of my colleagues would be open to or welcome to.
I think that we also can help with participating providers connect with candidate pools. So that's something that if we know you're hiring externally, we can help support that, just depending on, kind of what the program pathway is and the number of participants you're looking for. I mean, ultimately it is employer driven, so you would interview them with your standard HR practices. What we see currently in most of the cohorts is we see that probably providers tend to upskill people who are on staff about 50% of the time. And there's can be a little bit of variance, but what a great opportunity to invest in your own workforce and allow the opportunity for growth.
Looks like we have a hand up.
Yeah.
Okay.
Pat, do you want to come off mute and ask your question?
Yeah, please. I am curious how this might work if somebody already has, say, a bachelor's or a master's degree. Would they still be eligible for the apprenticeship? And how would that work if there's classes in that sample schedule that they've already had?
Lee, are you able to take that one?
Sure. So we do have apprentices that have prior education experience. I think that when you take a look at this sample schedule, if they have if you want to think of it more traditional transferability, that can certainly, we really don't want participants to be retaking something they already have that knowledge and content for. And similar in nature, work experience can be taken into account as well. And we have a process for that. Just if they have, we look at, this is the SUDP program, it's 4,000 hours on the job. There is a formal process they have to go through in terms of a formal request that is supported by the employer. And then it goes up through our kind of reporting structure with our oversight body, the JATC.
So would that
So-
time in class be cut down? Because again, they also don't have to complete the 4,000 hours. Yeah. So
Mhm.
I'm just curious if that's all worked out inside of the program, or if that's something that is just not a good fit.
So yes, if think of it as a transfer, if you think in a more traditional setting and such, it would need to be like if it was coursework that was directly transferable, think of it as transferring in, so they wouldn't have to take that particular course per se. And then if it's work experience that is related, it could mean that they are transferring in a certain number of hours. Both pieces would go through a formal process, and it could shorten the amount of related supplemental instruction time, or it could also shorten the hours on the job as well. And there's a formal process for both.
Thank you, Lee.
You're welcome.
Are there other questions? We don't have any other in the chat or hands up, but I think we have about 2 or 3 minutes. James, correct me if I'm wrong, because I know you have to wrap things up. But maybe one more question if we have time. If not, oh yeah, Lisa.
I was wondering if I could just elevate my question. I popped it into the chat, but I do know a number of master's level clinicians that have left the field, may have lapsed licenses or didn't complete their hours. Do you know of any efforts to re-engage or do outreach to that group? It just seems like a real untapped talent pool. Seems like the pathway is not really clear from folks I've talked to on how to get back in if you already have the master's.
Yeah, and I can feel that. That's on my list of the next things to be looking at, right? And it's definitely something we have identified this as well. It comes up often of, how are we, especially when we talk about clinical supervisors too. Like, if somebody, how do we come? I'm always asking people when I meet them, hey, you should come out of retirement. We need you. What can I do to convince you to do telehealth, like just half time, and so we're working on that. I can't give you any great answers. I don't have any yet, but it is definitely on the horizon of something we're going to be focused on. Any?
And you have a question from Christy. I don't know what yes. that means, Christy, but they've been
It
paying.
stands for, it's Youth Eastside Services. That's the
you.
name of our organization.
Did you ask the question you put in the chat?
Oh, yeah.
Yeah, I mean, so King County stopped some years ago helping agencies to pay for the tuition for folks who had their masters to get their substance use disorder professional certification. And so we started paying that for our employees, which has been pretty burdensome. And we've also taken advantage where there are scholarships like at Highline, but I'm wondering if that tuition reimbursement is part of this plan.
Yes, absolutely. And there was one more slide in this slide deck that we didn't have time to get to. And I will just echo this, that and I do know that you have an application in, your team has an application in for getting some of this funding, but the other program that we are doing specifically with this group of people who are doing the apprenticeships is this, what we're calling BEAM, which is the ability for our KCICN agencies to opt in, and we will pay their fees, and tuition reimbursement, certifications and licensing, professional development, that would be reimbursable. So an SUDP, dual clinician license would be something that could be reimbursable.
Yeah,
so
that's awesome. And so are we getting more information about that? Because you said it sort of looked like 2025 was sort of like go time for a lot of these things.
Yes, and we will be sending messages out that we'll have another presentation on this to kind of help people understand it next week. So you will hear from us.
Awesome. Thank you, Rachel.
Thank you, everybody. James, appreciate you wrapping us up.
Just want to thank everybody for coming over today for this incredible lunch and learn. Big round of applause, virtual round of applause for all of our presenters. Fantastic work here. We're really thrilled about this partnership and engagement and expanding the support in mental health and behavioral health. So really looking for additional updates as we continue on. But want to thank everybody here. And if you have any questions, as you know, please do feel free to reach out to the presenters. They did put their contact information into the group chat. And we want to wish you well. And once again, have a wonderful afternoon. Thank you for visiting us at today's Lunch and Learn, and have a wonderful week.
Thank you.